Hey guys, this is Josh, physical therapist assistant over at Crane Rehab. Now we're going to go over a general upper extremity exercise program. Starting out, we're going to work with the pulleys. So the pulleys works on range of motion. So for example, if Bryce had surgery on this shoulder, he's going to use this arm to help pull that into a stretching range of motion. So we're just trying to gentle stretch, and we're just going to go back and forth. So he's going to let gravity pull this one back down, and then use this arm, his good arm, to pull it back up to a good stretch. What you want to let patients know with this is they're just trying to go to that stretch. If they start to feel too much pain, don't go that far. Normally, somebody's going to do this for 3 minutes, whatever pace they feel comfortable. After that 3 minutes, we'll switch, and then we'll go into more of a scaption, which is going to be not all the way out to their side, but not all the way forward. So it's going to be about in between, and we're going to do the same thing. Using the good arm to stretch that bad arm, and then letting gravity pull it back down nice and gentle.
All right.
Next, in our upper extremity program, what we're going to work on is wand exercises. So this is in supine, we're working on shoulder flexion. And what we're going to have them do is just working gently with gravity to let that arm stretch out. Now, yet again, he will be using gravity and his good arm to kind of help with this. His good arm is going to help move through the wand and back down. Now, for some people, we may not go past here. Just go straight back, work on that flexion. Each person is going to be a little different. As their shoulder progresses, they're going to be able to go further back. This is just something that they can use their good arm to kind of help through the wand, push the surgery arm, and just back. All right. So next in our upper extremity workout, we're going to work on shoulder abduction. So we're using this wand to kind of help push it up. So he's keeping that surgery arm straight, thumbs pointing towards the ceiling, and he's coming back down. Again, his good arm is doing most of the work. The surgery arm is just hanging out as he pushes up. And this is going to be dependent on their range of motion at the time. And just let them go into a comfortable range. They still want to feel a stretch, but it shouldn't be painful. All right, next what we're going to work on is our external rotation. So that's going to be this arm rotating out. So what Bryce is doing right here, he's keeping his shoulders down, elbow tucked in, and then he's trying to use that other arm to push this into a comfortable range of motion. What you'll see with a lot of people is they'll tend to kind of push that elbow out like that to get more motion. We don't need that. Keep the elbow in, and even if they don't get as much rotation, if they just work it what they got a little bit at a time, it'll go further. So just look for that compensation and make sure they're doing it right.
Mm-hmm.
So once the person's shoulder is warmed up, we've done some range of motion, some stretching, we're going to work on some strengthening. We call this total shoulder exercise. So it's 5 or 6 movements that we're going to work on. The first one we're working on is shoulder flexion. So they're going to start with the band in their hand at their pocket, and then they're just going to try and raise it up and then back down. Again, we're working at a comfortable level for them. Keep going. Now, as they're doing this, if you notice Bryce's shoulder is staying down, come back down, just do a few of them for me. So he's not hiking his shoulder up towards his ear, he's keeping it down and just going from his pocket up as far as he can and then back down. Good. After we do flexion, we're going to work on extension. So extension is bringing the shoulder back. So yep, all he's doing is he's starting from a little bit further out, bringing it back to his pocket. Again, he's keeping his shoulders back, he's not hunching forward, and he's not hiking that shoulder up. So next what we're going to work on is external rotation. So I'd like to tell people they're going to start with the band at their belly and pull out. Good, so he's got a good upright posture, shoulders are back. We do want to get this towel in their elbow. That does a few things for us. It's a little more comfortable. It also lets us know if they elevate that elbow too much. Keep going, Bryce. So he has to keep his elbow tucked into his side to have that towel there. And we're just working right there. Now, again, with shoulders, some people may not be as strong right now, so we'll do their available range of motion. And we'll modify as we need.
Take two.
After external, we're going to work on internal. So this is the exact opposite. We're going to start out and pull the band into your belly. So same things apply. We're going to try and keep that elbow tucked in, shoulders down, just like Bryce is doing. He's not hunching. This is staying where it needs to be. Elbows tucked in. Good. All right, another exercise that's looped in with our total shoulder is going to be horizontal abduction with a punch. So how this works, we're going to start with our arms straight. We're going to pull the band all the way out, and then with the other hand, push. Good, do a couple of them for me. Now as Bryce is doing this, once he gets here, that's all steady. And as he pushes, we don't want to let that band pull us back in. So come out, lock this in place, boom. Now we're working on a serratus punch. So this is an exercise we like to do where we're going to work on a little loop band in his hand, looped around his shoulder. Now as he does this, he's going to try and keep his shoulder back and push forward with the band. Now, with this one, if they don't keep their shoulder back, so do one where you don't keep your shoulder back, the band's going to slip off. So they have to actually retract that shoulder blade and push as they do it. So do a few right ones for me. So he's keeping his shoulder back, pushing out, the band stays in place. Once that shoulder drops, the band's going to slip off.
Mm-hmm.
All right. Next, we're going to work on our prone row. So what we're going to have them do, lay down in a prone position, so on their belly, weight in their hand, and we're going to ask them to bring their elbow up to their side. So do that for me, Bryce. Do a few of them. Good. Now, they don't need to go any higher than just their side right there. They don't need to really try and do all of that. Just up to their side, nice and comfortable. Try and control it. You don't want to see them let the weight pull them down. And just right there. All right. Now we're going to work on sideline external rotation. So this is similar to what we did with the band, except they're going to be laying on their side. They may have a weight, they may not. And all they're going to do is try and bring that weight up towards the ceiling. Try and keep that elbow tucked in. This one may be for your lower level patients just starting out. They can't do the bands yet. Maybe not using the weight, maybe just using the weight of their hand. Last, we're going to work on serratus punch. So this is another one that we can do instead of the one with the band. We're going to work on weights in hands, no weights, hands straight up towards the ceiling. They're going to work on bringing their shoulders off the mat and then back down. So a lot of people are going to try and do more than what they need to do with this one. This is a very short movement. As you can see, Bryce is only moving his shoulders about 2 to 3 inches, which is all we need. So just tell them they just have to bring their shoulders right off the mat and then back down. Do a few more for me, Bryce. Beautiful.